Hello, I'm Dr. John with Gonstead Physical Medicine. Welcome back to this video. It's a pleasure having you here. In a previous video, we talked about cervical disc displacement. What accompanies cervical disc displacement quite frequently is something called stenosis. Now, stenosis means narrowing of an opening, and we're talking about the narrowing of the opening of the spine. And there are three openings of the spine that we're going to talk about where you develop stenosis. The first one is called the central canal. So the central canal is where the spinal cord goes through. And when the spinal canal becomes occluded or becomes narrowed, that is called central canal stenosis. The second place in the spine where stenosis could occur is at the foramina. And that's where the nerves exit the spine. And when it occurs at the neural foramina, that's called neuroforaminal stenosis. The third way you can get stenosis is called lateral recess stenosis. And it's an area between the disc and where the nerves exit the spine. And when that area becomes occluded, it's called lateral recess stenosis. Now, when you have stenosis, it's a lot of pain. You could have it in all areas of your spine. It's a serious spinal condition that should be treated as soon as possible, and it's caused mainly from two reasons. One is we talked about the cervical disc displacement when the bulge is actually bulging so much it goes into the neural foramina, goes into the lateral recess, and goes into the spinal canal. That's one way of developing spinal stenosis, is from disc displacements. The second one is called degenerative joint disease. What happens is the disc degenerates. You can see these are the two vertebrae, and you can see that there's not much disc between that because the disc has degenerated. This is what it normally should look like. And like I said before, the disc is the shock absorber, or it's like a tire between the two vertebrae that creates cushion. It's the shock absorber of the spine. But when it degenerates over time, the disc desiccates or dehydrates. So what the body does to protect the joint, it creates these osteophytes, or these bone spurs. Now, these bone spurs can start occluding those openings in the spine we talked about. These bone spurs can go into the central canal, the lateral recess, and into the foramina, creating stenosis. Now, when we look at this x-ray here of a typical patient, you can see that all this osteophyte formation has developed in the cervical spine, which is creating an occlusion of the openings of the neural foramina for this patient. So when that happens in the neck, it creates lots of pain, and that pain can sometimes radiate down through the arms. And when it occurs in the low back, it could radiate down to the leg. Now, having said that, if you have spinal stenosis, or if you think you might have spinal stenosis, come into Gonstead Physical Medicine. We'll evaluate you, and we will treat you accordingly. I'm Dr. 𝐤𝐴𝐵𝐻𝐿𝐵 with Gonstead Physical Medicine. What a pleasure, and I'll see you in the next video.